The Newsday continues here on One News Now. I'm Riza Diaz. Thousands of frontliners across the country will receive their COVID-19 vaccines today as a tribute to the workers sector on the observance of Labor Day. Let's get the latest on that story. Gemma Vansenia, she's joining us live from Davao City. Gem, how many frontliners have been inoculated in the city so far?
Riza, as part of today's Labor Day celebration, 10 volunteer workers under the A4 priority list were inoculated this morning at the Southern Philippines Medical Center. Health Undersecretary Abdullah Dumama said this is their way of commending the efforts of the modern-day heroes, which includes non-health frontline workers. DOH 11 Regional Director Annabel Yumang revealed that 72% of their target-eligible healthcare workers have already been inoculated. She added that vaccination for senior citizens will depend upon the availability of doses allocated in each local government unit. Also this morning, different groups led by Kilusang Mayo Uno Southern Mindanao region held a protest at Davao City's Freedom Park. A number of security forces were deployed to ensure that health protocols will be strictly followed. Protesters displayed an effigy showing the current situation of the laborers in the country. Riza PJ Dizon of KMU SMR said in an interview that the government should be held accountable for all the lapses they made in responding to the current pandemic. Riza?
Thank you for that report. That's Gemma Vansenia reporting live from Davao City. Now, time to take a look at vaccine stories from around the world. The World Health Organization lists American-made Moderna vaccine for emergency use, making it more accessible for distribution in poorer countries. Moderna is the fifth shot to earn the WHO's emergency listing after Pfizer, AstraZeneca, Serum Institute of India, and Johnson & Johnson. The Interior Department warns the public, do not buy fake Pfizer shots. Interior Secretary Eduardo Año tasked the PNP to investigate and confiscate these fake vaccines. The fake shot has a product name of BNT162B2 and was first discovered in Mexico. And a vaccine czar, Carlito Galvez Jr. says the country's world-class cold storage facilities are now ready for use. These storage units can accommodate up to -18 up to -80 degrees Celsius requirement for jabs like Moderna, Sputnik, Pfizer, and Novavax. DOH has also partnered with the third-party provider PharmaServe Express for storage and delivery of shots from airports straight to cold chain facilities and vaccination centers. Now, the lack of healthcare workers now appears to be a problem not exclusive to Metro Manila but in other areas across the country as well. Mobile journalist Jacob Lazaro gives us a front seat to the story.
Dr. Sheely Gaspi is one of scores of volunteer health workers from the Visayas who were deployed to Manila to help fight the surge here.
Total, iisa lang naman po tayong Pilipino. Sino pa ba naman ang magtulong-tulungan, di po ba?
But it isn't just Metro Manila that's been overwhelmed. When the DOH sounded a call for volunteers from the Visayas, some Visayas LGUs felt they needed help as well.
How can you help when there's shortage also here in Iloilo?
Dr. Mestidio is from Kalinog Town. Population, 63,000. Ideally, there should be one doctor for every 20,000 population. That means Kalinog needs 3 doctors. But Dr. Mestidio is alone in the rural health unit. Another ideal ratio is 1 nurse for every 8 COVID patients. But Kalinog, with 86 COVID patients, is far off the mark. It has only 2 healthcare workers.
I have seen wards that is managed by 1 nurse only for how many COVID positive patients.
Dr. Legaspi was from Eastern Visayas, the 4th hardest hit region by COVID-19. But she says there were many healthcare workers left, so her leaving didn't cripple them. But not everyone is as well prepared. Last month, the Department of Health mandated all private hospitals to increase COVID bed capacity from 20% to 30%. With a lack of healthcare workers, hospitals in outlying provinces say they just can't meet the new requirements.
A lot of them actually have already been penalized, as I said, by the Department of Health. they were already given written warning for not complying with the 20%, still 20%.
Dr. Degrano says some nurses in Batangas have threatened to resign should the COVID capacity increase any further. To comply with the DOH, Dr. Degrano says private hospitals will just have to reduce their overall bed capacity by reducing their non-COVID beds. This means less beds for patients who have diseases that are not COVID. With the pandemic greatly affecting everyone everywhere, Dr. Legazpi says frontliners are not the only heroes.
Dapat mismo sa atin manggaling yung responsibility para ma-stop po yung transmission ng virus.
I'm Jacob Lazaro and we are One News.
Meanwhile, a new study shows that rotational workers during COVID-19 pandemic have a high level of clinical depression. According to research by the International SOS, more than half of rotational workers reported a decline in their mood. The study also revealed that 4 in every 10 workers experience suicidal thought on rotation sometimes or all the time, while 3 in 10 workers met the benchmark for clinical depression. In a Philstar.com report, Dr. Rodrigo Rodriguez Fernandez of International SOS said the COVID-19 environment increased stress on already pressured working arrangement. Now, to talk more about the issue on mental health, joining us this afternoon is psychiatrist Dr. Bernadette ARCENA. Doc, good afternoon.
Yes, Riza.
Doc,
Good afternoon.
yes, based, Doc, on your observation and experiences as a professional, how are Filipino workers doing in terms of mental health in this time of COVID?
Actually, the initial stages, you can feel, no, the depression and the anxiety, the feeling of being so stressed during the time that they will do their rotations. Actually, Lisa, I am also doing my rounds in the hospital during the time. And, you can really feel, at times the feelings of feeling hopeless about things, about what's happening to our patients. And, the burnout syndrome is so high.
Mm-hmm. Doc, to what factors would you attribute these mental health concerns among Filipino workers? You mentioned perhaps being burnout or fatigue is one.
Yeah. Actually, the long duty time and, of course, the feeling that you're going to have also the COVID are the fears of our health workers or of our frontliners. And, that's not easy. Because at times when one of your call shift wouldn't be around, so you're going to do not only 24-hour, but also a 36 more or less, or 72 hours, and that's so tiring, no? If you're few in the COVID ward and ICU.
Doctor, are there industries or sectors that are most affected or vulnerable to depression?
We can say that burnout syndrome is very high in our medical frontliners and those working in the hospital. And not only that, those who are really working at the time of the pandemic can also be affected by burnout.
Doc, what signs should a person look out for, and what can one do if somebody could be experiencing these signs of depression?
All right. The feeling of sadness that usually would continue for 2 weeks. Feeling unmotivated, feeling like you are hopeless, helpless, worthless. And when there are suicidal thoughts that comes in, then that is already red marks for clinical depression.
Doc, from the end of employers themselves, how would you recommend they address these issues?
It is very important that there should be connections, even though it's digital, with the frontliners. The kamustahan is actually very important. And also make sure that they are well taken care of. Some, they do give emotional support. Others may also give, food or any support that you can give to them.
Well, thank you very much for your time and for your insights, and happy Labor Day. That's Dr. Bernadette ARCENA. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. Visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. Mask on, wash hands, and stay safe, Philippines. I'm Riza Diaz. We are One News.